Hello everyone, let's discuss a few common ECGs in this lecture. I hope you remember the simple steps on how to interpret an ECG from our previous lecture. So let's begin. Whenever you look at an ECG, it's always better to look at the rhythm strip first. Rhythm strip is basically the longest strip on ECG, which is usually lead 2. It is better to look at it because it gives a better view of P waves and other components of ECG. Let's interpret this ECG step by step. First step is the heart rate. It is tachycardia. See the RR interval? They're very close to each other. How about rhythm? Is it sinus? No, it's not sinus because in this ECG there are no P waves. It's QRST, QRST. Look at the zoomed part as well. It's QRS and T. There are no P waves. Next is to see if it is regular or irregular. It looks regular. The R waves are at an equal distance from each other throughout. Third is to look at the axis. Look at lead 1, 2 and AVF. All the QRS complexes are in the positive direction, so it's normal. For intervals, we cannot assess the PR interval because there is no P wave. However, the QT interval in this ECG is almost 9 small boxes, which is normal. P waves are not visible. The morphology of QRS complexes is narrow. Then we have segments. The PR segment, again, we cannot assess because there is no P wave. However, you can see there is some ST segment depression throughout the rhythm strip. In terms of T waves morphology, it is normal. So what did we see in this ECG? That it is a narrow complex tachycardia, it is a regular rhythm, P waves are not visible, and there is some ST segment depression. These are all characteristics of supraventricular tachycardia. In this ECG, you can see tachycardia clearly. There are no P waves. See, the P waves are missing. The rhythm is irregular. See, the R waves, they are not equally away from each other throughout. Somewhere they're closer, somewhere they are a bit far away from each other. The QRS complex is narrow. The axis, interval, segments, and T waves, they all look normal. So a narrow complex tachycardia, irregular rhythm, and no P waves visible is an ECG of atrial fibrillation with a rapid ventricular response. Here's another one. Again, you can see that it is tachycardia with narrow QRS complexes. So it is a narrow complex tachycardia. The rhythm looks regular. And these waves, which are in between each QRS complex, are called flutter waves or sawtooth appearance, which is best seen in leads 2, 3, and AVF. So this is basically an ECG of atrial flutter. Okay, now look at this ECG. Again, it is clearly tachycardia, but here the QRS complexes are very wide, right? So it is a broad complex tachycardia. Why is it important to know that it is a broad complex or narrow complex tachycardia? Because all the supraventricular tachycardias are narrow complex and all the ventricular tachycardias are broad complex. This is one main difference. In this ECG, the rhythm looks regular, right? There are P waves, like here. Look at this one. There is P waves as well. So this is basically what? This is ventricular tachycardia. The characteristics of ECG are that it is broad complex tachycardia. It is a regular rhythm. P waves are visible, as you can see here in the close-up, here. There are some capture beats and fusion beats. When one normal QRS complex is captured in between these broad complexes, that is called a captured beat. And fusion beat is when two beats are fused together. Then we have QRS concordance in all chest leads. Concordance means that all the QRS complexes from V1 to V6 will be either positive or negative. So they will be the same in all the chest leads. This is a very bizarre ECG. It's tachycardia. The rhythm is very irregular. You cannot really identify P, QRS, and T waves. The QRS complexes which you see are broad complex, and they're of different size and amplitude in all the different leads. So this is basically ventricular fibrillation. In this ECG, you can appreciate that again it is tachycardia, and it is a broad complex tachycardia. The rhythm is very irregular. You cannot appreciate P waves or T waves. But if you look at these QRS complexes, initially their amplitude is higher, then they become a bit short. Again, the amplitude increases, then in between they become short. So this is a ventricular tachycardia that is associated with prolonged QT interval. It is called torsade de pointe, which is a French word for twisting of points, like in between the points are twisted. In this ECG, the rate is tachycardic. The rhythm is clearly irregular. You can see P waves, but if you look at the morphology of P wave, it is different. Here it looks different. Here it is a bit like tall tented. Here it's inverted. Here it is inverted and a bit bifid. So an ECG that is narrow complex tachycardia with irregular rhythm and at least 3 distinct P wave morphologies in the same lead is multifocal atrial tachycardia. In this ECG, the heart rate looks a bit slower, so it's slight bradycardic. If you look at the rhythm, it's sinus because there are P waves, and it's completely regular. If you look at the intervals, then look at the PR interval here in this ECG. It's very prolonged. Normal is 3 to 5 small squares, and in this ECG it is almost 8 small squares. So an ECG that is sinus, regular, and the PR interval is more than 5 small squares, and that PR interval is constantly the same throughout the ECG, is first degree AV block. Okay, so in this ECG, the rate looks normal. The rhythm is clearly irregular. P waves are visible. And if you see that there is a PQRS complex, and then suddenly there is one P wave which did not conduct a QRS complex next to it, that means there is a drop beat. Also, if you look at the PR interval, it is prolonged in this ECG as well. It's almost 6 boxes here, then 7 boxes here. So an ECG that shows irregular rhythm with progressive prolongation of PR interval. Progressive prolongation means that the PR interval keeps on increasing until a drop beat occurs. That's a second degree AV block, Mobitz type 1. The only difference in this ECG from the previous ECG is that the PR interval in this ECG is prolonged, but it is constant. It is not progressively prolonging throughout. So an ECG that shows irregular rhythm, dropped QRS complexes in between with constant PR interval is second degree AV block, Mobitz type 2. In this ECG, the heart rate is very slow. It's severely bradycardic. You can see that there are so many P waves that do not have QRS complexes after them, which means that the atria and ventricle, they're not synchronized together. So there is atrioventricular dissociation. So an ECG that shows bradycardia, no association between P waves and QRS complexes, and when you see more P waves than QRS complexes, then it is complete heart block or third degree heart block. I think that's enough for today. In the coming lectures, we'll discuss some more ECGs. Take care. God bless you all.